So I'll cover pandemic data and some policy updates. We are at 40 cases per 100,000 county residents per day reported to the public health department. We know that this is only a fraction of the total infections in the county. We don't capture home testing, and we don't capture infections where there was no testing at all. Also, right now, when we calculate these with a delay, and the 4th of July holiday, as with most holidays, usually causes the numbers to dip, and so this is probably even lower than we might otherwise expect. Test positivity is fairly high, 14%. I think pandemic all-time high was 18%. So we're getting up to those levels. 5,600 reported lab tests per day. Again, this is probably a little lower due to 4th of July. 159 people in the hospital, 21 in the ICU. That 159 is the highest number we've seen this spring. 67 deaths reported to the county between April 1st and July 1st. So the spring wave, which really began back in the beginning of April, appears to be having a second peak after a period of improvement in June. This may be due to an emergence of BA.5, the BA.5 subvariant of Omicron. But you know, variants aside, overall, I think these conditions more than anything just reflect an increase in return to pre-pandemic activities across all our communities and beyond the county borders. Next slide. So this is our daily case rate going back to the beginning of April, the spring wave. You can see we had a peak on June 6th, and then a decrease in our case rate. Now, testing dropped quite a bit in early June, so you have to interpret this with caution. But then things did seem to be plateaued. But I'll show you some slides where you can see the increase that really started in late June when you look across all our different metrics. Next slide, please. So here, test positivity, again, sort of a period of stability in early to mid-June, and then a pretty striking increase in the end of June. Next slide, please. If you look at our wastewater, this is just East Bay Municipal Utilities District, and there's a lot of noise in the data, so you know it's a little harder to see the pattern. But you can see that things are continuing to go up. Really, no evidence of a decrease yet in circulating COVID, and this is data up through July 7th. So really, a lot of COVID around still, and no clear evidence yet that we've peaked. Next slide. Hospitalizations, this is going back again to the beginning of April, and you can see things didn't really start increasing until May, and then they increased steadily, peaked on June 12th and improved for about 10 days, and then this late June increase again. And in fact, as I've said, we hit our peak for the spring yesterday, after a few weeks where things were quiet, and that may be, again, the 4th of July holiday, fewer things happening in healthcare settings for a few days, but I think we could see continued increases. Next slide. Now, by the standards of the whole pandemic, this is hospitalizations going back to April of 2020. You can see we're still lower than all of our major waves, and quite a bit lower than where we were this winter in terms of hospitalization. So that's good. We also understand from the state, they estimate that about 50% of people hospitalized with COVID right now actually are hospitalized for other things, and COVID was not contributing to their illness. And that's a bigger proportion than in past waves. Nevertheless, with increases, that still means we're seeing increases in people with COVID disease in the hospital, and we don't yet know where things will end. Another piece of relatively good news is that the ICU numbers have remained low. That's the yellow line at the bottom. And you can see we are far below past wave peaks in terms of ICU hospitalizations. So that is good. We're seeing impacts, not to the degree, certainly of the last couple waves, but the longer this drags on, those will accumulate. Next slide. So where are we going? I think it's very hard with COVID these days and these variants circulating and sort of life, people trying to do more and more pre-pandemic activities. Very hard to know where things will go from here. This is one of many different groups that try to project future hospitalizations. And what you see on this chart is this black line. That's the dots are true hospital data. The black line is their projection, suggesting maybe we're at peak and things will sort of level out through the rest of the summer. But the purple shaded area is the uncertainty in the model. It could be as bad as the top of that purple shaded area, or it could be as good as the bottom. And I included this just to show that it's very hard to know where exactly things will end up this summer. I do think we're going to continue to see our numbers worsen in coming weeks before we start to improve again. Next slide. So some key local policy updates. We had a mask requirement in place December 3rd. We lifted it, June 3rd. We lifted it June 24th. After that period of stabilization or improvement across several of our metrics, unfortunately, as I've shown, we immediately saw these increases in late June and early July, not just here, but across the Bay Area. Indoor masking remains strongly recommended at this time. As you know, we're big believers. Masks are a great tool for people to protect themselves out in those crowded spaces and to protect those around them. We also aligned our quarantine policy with the California Department of Public Health and Cal OSHA. Quarantine of close contacts is no longer recommended in Alameda County, except in high-risk settings. And I know it seems like a strange time to do this, but actually, because the vast majority of people don't really know when they're exposed, and because these variants tend to cause illness very quickly, we don't think, and because most people in Alameda County were not subject to our prior quarantine requirements, we don't think that this actually poses a substantial risk to public health. And not just that, but we are moving to the California Department of Public Health definition of an exposed person, which is broader than the prior definition. Anyone in a shared indoor airspace with an infectious person is considered exposed to COVID-19. We've known for a long time that COVID-19 is an airborne illness. It spreads through the air, and it can spread pretty extensively in indoor settings. And so the California Department of Public Health has tried to reflect this in their guidelines better than it was previously. So those people don't have to necessarily quarantine, but masking for any exposed persons for 10 days after that exposure is strongly recommended. It's recommended for everyone in indoor spaces, but it's particularly important if you've had an exposure. And testing 3 to 5 days after exposure is recommended as well. Isolation of persons who have COVID infection is still required. So remember, quarantine is if you're exposed, but you're not sick yet. Isolation is when you're sick with COVID, you've had a positive test, or you have COVID symptoms after an exposure. You should stay home in those situations. Next slide, please. Another important policy update. So this is the state has updated their K through 12 school COVID guidance for the upcoming school year. We have been aligned with the state on schools guidance for over a year and a half now. It's fairly streamlined. Just in brief, the focuses are continuing to improve indoor air quality, for mask use in schools to it's going to follow the guidance at the state level for the general public. So they're not going to have separate mask rules for schools. Right now, statewide, masks are strongly recommended in indoor settings. The guidance also supports antigen testing access for students, hand hygiene, of course, staying home when sick, and also making sure to continue to notify families about COVID exposures in the classroom. Similar to our overall quarantine policy and consistent with the state's overall guidance, children can stay in school after an exposure, but masks and testing are recommended. And class closures are really a tool of very last resort. We really want to try to avoid further disruptions to kids' education.